Hello, this is Kerry Duke with KCFrank.com, and we're interviewing Dr. Ethan Schumann, and you are with the Schumann Center for Dental Aesthetics. And Dr. Schumann, how are you today?
I'm doing great, thank you. How are you?
Doing wonderful. Now, you're
Good.
located in Missouri, St. Louis. What is your exact address?
We're at 658 North New Ballas. That's B as in boy, Allas Road, which is in West County.
Okay, very good. All right. Now, what we want to talk about today, Dr. Schumann, are dental implants, and we're going to cover the five most common questions that I believe you typically get about dental implants. So
Okay.
here's the first question, and I'm going to read these off as if I am a candidate for dental implants. So, number one, I have heard of potential candidates for dental implants must qualify. Now, what does this mean, and how would I know if I'm a good candidate for this procedure?
Okay. Well, first of all, let me tell you that we have to reverse the questions. First, how would we know whether we are a candidate? And then I'll deal with how do we find out whether or not you do qualify. Okay. So the first way to find out is through a free consultation. So come in, we'll take a couple of x-rays, and we will look and see and review medical history. Okay? What are the qualifications in order to qualify? You see, dental implants have to sit into bone. So patients that don't have adequate bone possibly are not candidates. We have ways of augmenting the bone. So we have to determine whether there's adequate bone there that can really support a dental implant. Okay? In the cheeks, for example, we have sinus cavities in here. And those are just air spaces. Those are not bone. So we can't put a dental implant into air. It needs to be anchored. It needs to be anchored into the bone. So we're looking for adequate bone, both in height as well as in width. Okay? As well as quality of bone. Okay? The other factor is we're looking at the medical history. Okay, and there's a few diseases, a few syndromes which would preclude dental implants. But by and large, everyone is an implant, a candidate for implants on one level or another.
Excellent. Okay, question number two. Given the cost of the dental implant procedure, one of the main concerns is how long they will last. So what's your opinion about that, Dr. Schumann?
Well, once you get a dental implant, it's sort of like buying a car. You know, you buy the car, but you still have to go back to the dealership and change the oil, do maintenance every 3-4 months. It requires maintenance. And in dentistry, once we put it in, it's not like set it and forget it. It doesn't work that way. No matter what we do in dentistry, it always requires come back, let's take a look, make sure everything is functioning as it should. And dental implants are no different. We like to have patients back periodically, every 4 months, every 6 months, just to check on things, make sure that everything is good. Because if there is a problem, we can very often, usually, intervene and make sure that we correct that problem. Given that, having said that, dental implants can be lifelong restorations, and oftentimes are lifelong restorations.
I like that. I like that analogy of the car because that's something that people can relate to. Yeah, you do not run a car without having regular and routine maintenance.
Absolutely. Everything requires, your furnace, everything requires some servicing. It goes through mechanical wear and tear. In our mechanical devices, they call it metal fatigue. Okay, in our mechanical devices, no matter what they are, it requires some type of maintenance and upkeep. If you're using it, you'll break it ultimately.
Okay, question number three. Dental implant surgery is only one of a handful of options to consider when replacing lost or damaged teeth. Is the recommended care for dental implants greater or lesser than other options in terms of both ease of use and cost? And then there's the why.
Very good question. Everything that I mentioned previously requires some maintenance, but dental implants have a certain advantage, And that advantage is that they are made out of titanium, which is a miraculous metal, a miraculous material. And one of the wonderful things which it doesn't do, unlike natural tooth structure, it doesn't decay. We don't have that problem with metal dental implants. That doesn't happen. However, there are bone issues that we have to look after and make sure that the bone is there and intact and just where it should be. Okay, and the reason is, as I said, because the metal does not decay and does not deteriorate, and the restorations which are on top of those dental implants likewise do not decay. So that's a tremendous difference and a tremendous benefit. And I'd like to go back to your opening statement, which was the handful of ways that we can replace a missing tooth. There aren't that many ways. I'll mention 3, and I'm hard-pressed to find a 4th. 1 is dental implants. 2 is a removable type of denture. Removable type of denture. And the 3rd is a type of a bridge, a cemented bridge. And let me speak about those 2 other options beside dental implants. I've been doing dentistry for quite a few years, many years, and I get plenty of attaboys and plenty of praise for the work that we do, but I really am hard-pressed to think of one patient that said to me, "I love that removable partial denture you made me." People just don't like them. It's a piece of hardware, a foreign body in your mouth, and people just don't like them. It is an alternative, a good alternative, and it works, but people are not in love with them. Okay? The cemented bridge option, which I mentioned, let me explain. I'm in St. Louis. That's a river town. We have Illinois on one side. We've got Missouri on the other side. And these are the 2 teeth that surround the gap, the border of the gap. We're missing the tooth right here. In St. Louis, we call that the river. Okay, we've got the Missouri tooth, we've got the Illinois tooth. And in order to give us that false tooth, or the bridge going across the span, we have to rest our tooth on the Missouri tooth, our crown on the Missouri tooth, and a crown on the Illinois tooth. And that works very, very well. We've been doing that for literally hundreds of years. The problem is, it's a great solution, but it's based upon 2 natural teeth. 2 natural teeth which were designed to support themselves and just themselves. Now we're asking those additional teeth, those abutting teeth, abutments we call them, to support 1.5 times their natural load, what they normally are expected to carry, because they've got to carry that false tooth, the bridge, which spans. Additionally, they are natural teeth, which means that they're subject to wear. As we get older, of course, we put more mileage on our teeth, and they're subject to that wear and tear and stress. And if there's ever a problem of decay or fracture, well, that can jeopardize our entire bridge. The beauty of dental implants, one of the beauties, is in order to replace that missing tooth in between those 2 abutment teeth, it just involves that 1 tooth. It doesn't interfere with Missouri or Illinois, if I could use that metaphor. It doesn't interfere with those 2 teeth in either way, in any way. So those 2 teeth remain just as they are, which is a distinct advantage.
So just to reiterate what you just said, the dental implant is a more comfortable and longer lasting procedure, but it also has less of a negative impact on the surrounding teeth. Is that correct?
That's a great way to say it. Very good. Yes, that's
okay.
Exactly correct.
What about the cost difference between those other 2 options versus dental implants?
Well, I will tell you that's a really good question. The truth is that the cost of a cemented bridge to replace 1 missing tooth is about the same as 1 implant with the crown on top of it. So it's about the same cost. Time, however, is radically different. Time, however, is much different. We can replace, using a cemented bridge, in about 2 weeks. We prepare it today, we cement it in 2 weeks. Dental implant, on the other hand, we put the implant in, and then it takes about 4 months, depending where, of course, we place the implant, but on average about 4 months, for the bone to really grow onto the implant. Okay? And then another couple of weeks to put the crown on. So you're looking at approximately 4 months, 5 months, something in that order to get the implant completed. It is possible, of course, in most cases, many cases, to put a temporary on top of the implant, so that you do have something there for that healing period. But it's not going to be totally, fully in function for about 4 months, approximately.
Okay, well that leads right into this next question. When we're talking about the dental implant process and how long it takes, well, you answered that part. But what about my ability to do the things I like to do, eat my favorite foods and things like that during that process? What's my lifestyle during that process?
Well, again, there are a couple of ways to go, and the answer that I give you does not apply to every patient, because there is a grade, a grade levels of quality of bone. Now, some people have bone like cast iron, that we can put that implant in there as like a drywall screw, like an anchor, and it could be loaded right away. It can be used right away. Other people, depending on race, age, gender, other medications that they're taking, genetics, the bone might not be quite as solid, in which case we have to wait and be patient. So, in general, we have a temporary of some type in there, generally speaking. So there's really very little change in your quality of life during that period.
Awesome. You're making it sound like dental implants is a great thing to have.
Well, it really is, and if you think about that, it's kind of miraculous. I mean, if you think about it, really, because we're able to take a little slug of metal, put it into the bone, and the bone treats it as if it's family. It grows onto it. That's a remarkable, remarkable phenomenon. We live in really amazing times from a dental perspective. Medical certainly, but dental as well. They were able to replace teeth, which from time immemorial, once a tooth was lost, it was lost. And it's definitely a quality of life issue. It helps us to phonate, to smile, to communicate, and of course to eat. Definitely a quality of life issue, and we can replace it as good and sometimes even better than it was to begin with.
Okay, one final question. We touched on cost comparative to other procedures, but is there a price range for implants? And if so, could you provide that? And then also maybe tell us if you have any financing options.
Very good. When we speak about dental implants, we have to sort of define and understand what we're talking about. I gave you the example just a few moments ago of a missing tooth between two adjacent teeth, two adjacent healthy teeth, or we're missing one. I used the metaphor of Missouri and Illinois. That's a case of replacement of but a single tooth. But how about if we were missing 3 teeth? Well, we would have 2 abutments serving as the Missouri and the Illinois supports, and then we would have the span which goes across. So we're replacing 1, 2, and the third is the false tooth in between. How about in the case of missing 4 teeth? So we move Missouri and Illinois just a little bit wider river. So we've got the Missouri tooth, the Illinois tooth, and the 2 false teeth. The bridge has become just a little bit longer. So there we've got 4 teeth resting on 2 implants, or a case of 3 teeth resting on 2 implants. So the cost really goes down the longer the span is. Okay, we are able to. Does that make sense? Do you understand what I'm trying to say, Carrie?
I believe what you're saying is that on a per tooth basis, the more teeth you have, the lower the cost.
That is correct. And we do a wonderful procedure called all-on-4. For people that have been suffering with dentures their whole lives, we're able to put in 4 dental implants in the arch, 4 dental implants, and make a horseshoe shape, an arch shape of teeth, which goes all the way around. And it's really, really a marvelous thing to do. And we can give those teeth that are supported by 4 implants. We have other options. People that have a denture which is flopping around. Many women, older women, have a problem where the lower jaw has atrophied. We don't have much bone here, and they can't support the number of implants that we would like. But they generally have very good bone right here in the chin area. And in that case, we're able to put in 2 or even more implants right here, and suspend a bridge, a horseshoe-shaped appliance of one type or another, which can be either removable, snaps in, locks in, and can be removed, or is actually screwed in or cemented into place. So we have a number of different options.
Okay. Do you have financing available at your office?
We do have financing available. We have something called Care Credit. And Care Credit is a program, it's an interest-free finance plan. So if you borrowed, let's say, $12,000, by the end of the year, you pay $1,000 each month, and you've retired that debt. Zero interest, which is a pretty good deal.
Excellent. Now, is there any one thing maybe we haven't covered that you think needs to be covered when we're talking about the most common questions regarding dental implants?
Uh, I think that the number one question that people have, I think, before they even pick up the telephone, is that they say, I'm really confused by this dental implant thing, and I want to know more about that. There aren't too many offices that I'm aware of that offer free consultations. We do, because it's really a wonderful way for people to come in without any obligation. Take a look at my mouth. What do you think? And or a second opinion for that matter. So it's really a wonderful way to do it. We've been doing it for years, and it's great. Patients like it, and we like it as well.
Very good. Okay, so Dr. Schumann, you can be found at the Schumann Center for Dental Aesthetics in the St. Louis area there, and the phone number that people can reach you at is 314-202-6627. I want
That
to
is
thank
correct.
I want to thank you for your time today, and we look forward to the next conversation.
Carrie, thank you very much. Great talking with you.